Congratulations on your new baby. This video, brought to you by the Evergreen Health Lactation Consultants, is designed to answer questions you may have about breastfeeding your newborn. During the first few days and weeks after birth, you will spend a lot of time nursing your baby. Let's spend a few minutes reviewing tips on how to latch and position your baby at the breast. A deep latch will allow your baby to drink milk effectively and will help prevent and heal sore nipples. The first step to achieving a deep latch is to start with mom's position. Sitting in a reclined position with your feet elevated will allow your baby to be comfortable at the breast. If you're sitting on your couch, sit as though you are settling in to watch a long movie. It is normal to feel hungry and thirsty every time you nurse, so have water and a snack handy. If your baby tends to be sleepy during feedings, you may find skin-to-skin contact helps keep your baby more alert at the breast. When you bring the baby close, make sure her body is turned right to you and that she is in good alignment, so her ear, shoulder, and hip are all in a line. Next, tuck the baby's bottom under your opposite breast. This will allow your baby to be even closer. Bring your arm to baby's lower head and neck for support. Use your elbow to pull baby's bottom even closer. Some mothers find they need to support their breast during feedings, while others do not. If you need breast support, make sure your hand is far back from the areola. Your hand may need to be all the way back where your underwire is. Bring baby close enough so her chin touches your breast. When your baby feels your breast on her chin, she will lift her chin and open wide. When you see this wide open mouth, use your hand behind her neck to bring her onto the breast. Resist the urge to place your breast in baby's mouth like bottle feeding. Once the baby is latched on and sucking, you may feel you no longer need to support your breast with your hand. Let go of your breast and bring your arm around your baby's body, bringing your elbow close to the baby's shoulder. At this point, you may feel tucking a pillow under your arm will give you a little more support. This position gives you freedom to nurse having one hand free. If you don't feel like you're there yet, don't worry. You'll have lots of time to practice, and you'll get there soon. Some newborns love to have their hands in or near their mouths. Being in a reclined position and bringing baby close will help her hands relax. A helper can hold baby's hand just for the latch, if needed. When your baby first latches on, the nipple stretches inside baby's mouth. For some mothers, this is an intense sensation. However, the initial latch-on sensation should subside within a matter of seconds. If you continue to feel pinching or biting during the feeding, break the suction with your finger and start again. If you have pain during breastfeeding, there are lactation consultants to help. Call the Breastfeeding Center at Evergreen Health to schedule an appointment. Nursing your baby lying down is a great way to rest after birth. Side-lying nursing, as it's called, starts with mom lying flat on her bed. Begin by turning far onto your side so your nipple is about 1 inch from the surface of the bed. Putting a pillow between your knees may make you more comfortable. You may find it easier to have a partner bring the baby close to you. Baby should also be on her side completely. Bring the baby close enough that your tummies touch. When she opens wide, your helper will bring the baby to the breast. Putting a rolled blanket behind the baby's back will help keep her close. During the newborn stage, this position takes practice and may take 2 people. But remember, you'll soon be able to latch your baby while lying down all by yourself. There are many positions to nurse your baby, and there are no rules on how positioning has to look. The key is to make sure baby is latched on well enough to drink milk effectively and to ensure comfort for mom. As you get more confident, you will find your own favorite position for nursing your baby. As always, the Evergreen Health Lactation Consultants are available by phone weekdays to answer your questions or schedule an appointment.